Hey everyone, welcome back to Medical Terminology. This week we're going to cover Chapter 3, which is suffixes. Learning outcomes for this chapter. We will describe how suffixes are used to form medical terms. We'll also identify and apply common medical suffixes related to sensations and feelings. We'll also identify and apply common medical prefixes related to conditions and symptoms, as well as related to the body processes. We will also identify and apply common medical suffixes related to body parts or chemical elements, as well as related to surgical or procedural processes. We'll also identify and apply common medical suffixes related to pathology or diagnosis. And finally, we will identify and apply common miscellaneous medical suffixes as well. Learning outcome 3.1. Let's define what a suffix is. So suffixes are used at the end of a word root or combining form. Suffixes act like nouns, adjectives, and verbs, only describing or adding to the term with different types of descriptions. Now, let's go back to the top part where we said that they are at the end of a word root or combining form. A suffix is going to be what determines whether or not we're going to use that combining vowel. So if your suffix begins with a consonant, we need that combining vowel to aid in our pronunciation. So if your suffix begins with a vowel, we don't need a combining vowel because the vowel from the suffix is going to be used in that pronunciation. An example of that would be itis. If we were using itis as our suffix, then we are not going to need a combining form, or we won't need that word root to be a combining form. We won't need that combining vowel. We can directly attach it on there. But if we have one like logi, which is the study of, we are going to need that combining vowel. So we'll need that combining form, that word root to be in combining form. Let's see what that looks like. So here you can see we have dermatitis. So itis is our suffix here, meaning inflammation, and dermato is our combining form for skin. Now if we drop that O and we just have dermat, that's our word root. So I want you to understand the difference between a word root and combining form. The combining vowel is what makes it a combining form. So here, we don't really need that combining vowel because itis begins with a vowel, so we can just attach the word root dermat directly to itis to get dermatitis. And remember, we always start from the suffix when we are giving our definition. Therefore, this is inflammation of the skin. So we do inflammation, which is itis, go back to the beginning to dermat, and define that last. All right, learning outcome 3.2, suffixes related to sensation and feeling. Now we're going to go over a bunch of different suffixes. These are also in your flashcards, which I highly recommend that you do. Also your practice tests. All of your questions from your chapter test are going to come from that practice test. So if you do that practice test an unlimited amount of times, you can do it however many times you want to do it to get to 100, because at the end of the semester, all of those tests are going to count towards extra credit. And I have seen that save some people from failing the class, or it's bumped them up a letter grade. So that is up to you. It is there. It is a great way to study and make sure that you're ready for that chapter test. All right, let's start with some of these sensation and feelings. So first we have algia. Algia you're going to see a lot. Algia means pain. Then we have asthenia. Asthenia is a weakness. You might have heard of the term myasthenia gravis. If not, you're going to. Then we have desis. Desis is binding or fusion. Arthrodesis, that would be the binding or fusion of a joint. Dynia. Dynia is another one for pain. So notice we have algia and dynia. Then we have aesthesia. You might have heard that as anesthesia, right? Anesthesia. So this is aesthesia, which means sensation. And we've learned in our prefixes means no, not without, right? So it's without sensation. Then we have kinesia or kinesis, which means movement. You know, if any of you are kinesthetic learners, you learn through doing things, right? Moving your hands or whatnot. Then we have phobia. Phobia is fear. Phonia, sound. A good way to remember this, you gotta have sound when you're speaking on the phone, right? And then phoria, feeling or caring. You might know this word part from like euphoria. Learning outcome 3.3, suffixes related to conditions or symptoms. So here we have cell, which is hernia. Then cytosis. Cyto is the combining form for cell. So osis is usually an abnormal condition. Therefore, cytosis is a condition of the cells. Then we have ectasia or ecstasis. Those are expansion or dilation. We'll use that a lot for dilation. Edema, which is swelling. Ema, which is a condition. Emesis, vomiting. We will see that one as well. Iasis, which is a pathological condition or state, or it means presence of. All right, next we have ism, which means condition or disease. Itis, plural is ites, and this is inflammation. You will see itis so much. This is one you're going to learn at the end of this class, whether you want to or not. We will use it quite a bit. Lepsy means seizure, like epilepsy. Narcolepsy means seizure. Leptic, now this is that pertaining to seizures, the adjective form. Lithiasis, presence of stone. You might also see lith. Lith is a part for stone. Mania, obsession or madness. Megaly, enlargement. Think of it's mega, right? So megaly is enlargement. All right, then we have oma, plural is ome. This is a tumor or neoplasm. Remember neoplasm? It's like a new development. Opia or opsia, both of suffixes for vision. And we have osis, again, condition, state, or process. Paresis, now this is a slight paralysis. I also like to call it partial paralysis. Feeling of numbness and tingling. Then we have pathy. Pathy you'll also get used to. This is an abnormal condition or disease process. I always say pathy means disease. Right? Then we have penia. Penia is a deficiency or small or fewer. Philia, which is the attraction or affinity for. Phrenia, which is of the mind. You might have heard the term schizophrenia. Then we have phthisis, which is wasting away. Physis, which is growing. Then we have plegia. This is full paralysis. Here you'll notice we have plegic, which means pertaining to paralysis. Remember, if it's an ick, it's probably going to be a pertaining to whatever's before the ick part. Ptosis. This is falling down or drooping. We'll see this in terms like blepharoptosis, which is a drooping of the eyelid. Rhea, you'll see this one quite a bit, which means flow or discharge. You might be familiar with diarrhea. That's one of them. Rhinorrhea, it's a runny nose. So rhea is a flow or discharge. And then we have ragia. Ragia is excessive bleeding, and that could be in the amount or the frequency. I also think of like a raging river busting forth. It's just, it's really flowing. Rhexis, I think of the X. X marks the spot where it ruptures. So rhexis means rupture. Trophic, pertaining to nutrition. Trophy, which is nutrition. You'll hear of hypertrophy. All right, now let's look at some suffixes related to body processes. So we have blast, which means immature or forming. Also, it's the embryonic stage of development. So think of when you're young, you have a blast, right? So that's what blast is. Blast is immature. And then we have sidal or side, both mean killing or destroying. Then we have crin, which is secreting. Think of like the endocrine system, right? It secretes those hormones. Malacia. Malacia is softening. So osteomalacia is a softening of the bones. Then we have para. Para means bearing or given birth. So you'll hear terms like primipara. Remember, we learned that primi means first. Paris, which means bearing or producing offspring. Pepsia means digestion. Actually, this is why Pepsi is named Pepsi, because back in the day they used to use it for indigestion. Or you might have heard of Pepsid AC or Pepto-Bismol. Anything that's Pepsia, that's going to be your digestion. Then we have phage or phagia, which means eat or devouring. Aphasia means to speak. So you got the S in there. Maybe that can help you remember the speaking part. Phoresis means carrying. We have plasia, which means formation, development, or growth. Plastic means forming. So you might have heard the term neoplastic, right? So it's forming new cells. And then we have pinia. Pinia is breath. I do want to make a comment real quick on the way that pinia is pronounced. Now, if you have a term that begins with P-N-E-A, like pneumonia, you're not going to say that P sound. But if the P-N is in the middle of a term, you pronounce the P and then the N. All right, here we have poiesis. Poiesis means production or formation. Then we have poetic, which is the pertaining to production. Remember that IC kind of means you're pertaining to something. Poietin is the substance that produces. Porosis, lessening in density. Remember we kind of talked about osteoporosis. Then rage, that's discharging heavily. Think of that raging river. Rhea is a flow or flux. Again, flowing or discharge is also acceptable. We have schisis, which is splitting. Somnia, which is sleep. Think of people who might be insomniacs. Spasm is a contraction. Stalsis, this is contraction as well. Think of peristalsis, which is the movement of your food through your digestive system. And we have stasis. Stasis means stopping, constant, static. I also like to say stopping or controlling. So think of like hemostasis, right? We're maintaining a certain environment or keeping everything as it is in a constant. Then we have stenosis. Stenosis is narrowing. We will see that one a bit. Another one you're going to see a lot. So let's talk about suffixes related to body parts or chemical elements. So we have site. Site means cell. You will see this one a bit. Derma. You'll also see dermato, derm. Those are all skin. Then we have emia. Emia is blood. I like to say blood condition, but technically when you go back to the etiology of the word, emia is blood. Emic is relating to blood. Remember that ick, relating to. Globin or globulin is a protein. Oxia, this one's pretty easy-ish because you have the ox in there, which means oxygen. Hope you remember. Then we have plaquia, which means plaque. Then you also have plasm or plasia, which is thing formed or a growth. Remember, we have neoplasm, that's new growth. Neo is new, plasm is growth. And then urea. Urea is urine. This one's a pretty easy-ish one to remember. All right, suffixes related to surgical or procedure processes. So we have centesis, which is a surgical puncture to remove fluid. So you might hear of a term called thoracentesis. That's when they're removing fluid from the chest area. Remember, some of this stuff that I'm saying you don't have to remember right now. I'm just trying to give you something to connect it to later. And then when you see it again later, maybe it'll be easier for you to recall. But centesis is surgical puncture. Ectomy, we probably heard this one before. So this is removal of part or all of an organ or body part. So some of you may have had a tonsillectomy, where you had your tonsils removed. Lysis means destruction of. Lytic, there's that ick. We're pertaining to the destruction. Pexy is surgical fixation. Plasty. Plasty is surgical repair. Think of like a plaster wall that has a crack in it and you got to try to repair it. So plasty, or if you've thought of plastic surgery, same thing. They're surgically repairing or they're altering really, but plasty means repair. All right. Then we have Raffi. Raffi is a surgical suturing. Now I kind of think of Raffi like you're wrapping, like you're taking a needle and going around in circles. You're kind of suturing with that. And then static or stasis, it's maintaining a state. I try to use student references as much as I can because, you know, what works for me might not work for you. I think someone had mentioned like when they have static or something and their clothes stick to their body and it maintains that area, like it's stuck to it, right? So maybe that'll help. I'm not sure. Stomy. Stomy is an opening. So if you think of like a colostomy bag, right? The stoma is the opening itself. All right, that stomy is actually creating that opening. All right, then we have tome. Tome is a cutting instrument. And then tomy is the cutting operation. So this is the act of. Usually when you see that Y at the end, something is happening. So that's why with stomy, even though it says opening, you're actually creating that opening. and tomy is the process of that cutting. Tripsy is crushing, so as you can see, something's happening, something's getting crushed. Then we have suffixes related to pathology or diagnosis. So you'll see crit, that means to separate. I know if some of you have labs done, you might see hemocrit. Gen means producer, right? It's generating. Genesis is origin. So at the beginning, think of like the Bible. Some people refer to that. Genesis being at the beginning, the origin of the Bible, where it starts. Genic, produced by. And gram is a recording. Now I always like to say you're going to have graph, graphy, and gram. Those are all related. So think of like Instagram, right? You got the pictures. So the gram is the picture. The graph is the instrument that it is used to take the picture. And then we have graphy, and that's that process of taking the picture. Now, if you don't remember all that right now, that's fine. I'm just trying to lay that foundation. All right, then we have graph, which we just talked about. Graph is that recording instrument, excuse me. Graphy is that process of recording. And then we have meter and metry, which also work kind of similar. So meter is the measuring device. Think of like a meter stick. And then we have metry. Metry is the process of measurement. So that is the measurement itself. Then opsy, think of like your optical, right? Your eyes. So opsy is the view of. It's that process of viewing. You could also think of like scopy or fluoroscopy, right? We're process of viewing that. Then we have phoresis, which is removal. Fill, which is attraction or affinity for. Fill or file, you'll hear both. Scope is instrument for visual examination. Scopy is that process of viewing, so it's the use of an instrument for viewing. All right, then we have additional miscellaneous medical suffixes. So we have add, which means towards. So think of like in math, right? When you add or subtract. So when you add, you're adding more, right? It's going towards the first number, so it's being included. Then we have classed or classis, which means to break. So classed is very close to the word cast, which you need if you break a bone, right? So you can kind of maybe think of classed and fracture. Then we have form, which means in the shape of. Ick, again, as we've seen on so many of these other suffixes, ick is pertaining to. Then you'll see icks. So we got that S on there. Now this changes it a bit. So this is treatment, practice, or body of knowledge. So think of like psychiatrics, pediatrics. So that's where that part comes from. And then logist is the one who studies. So like a psychologist, that's the one who studies the mind. Then we have logi. Logi is different than logist. Logist is the person. Logi is the study or the practice of. And then we have oid. Oid means like or resembling. We'll get to that a little bit more later down the road as well, but you might hear of like the mastoid process. Now mast means breast. Oid is resembling, and your mastoid process is right under your ear. So if you look at a skull, you'll notice a little protrusion. It kind of droops down, and that's actually where the sternocleidomastoid muscle actually inserts. So again, we'll get to that as well. But I just want you to understand that oid is that resembling, like a humanoid. And you might have seen that in a sci-fi movie or something. Resembles a human, but it doesn't mean it is. All right, then we have phlaxis, protection or prevention. Plegic, which is pertaining to paralysis. Then stat, agent to maintain a state of equilibrium. Finally, we have tropia. Tropia is turning. Tropic, turning toward. So this is something that's happening. Trophy, which is attracted to target structures. So tropy. And then version, turning. So you'll think of inversion. That you'll hear that one a lot, and that's like a turning inward, of course, because in means inward. Great job, everyone. Let's review this chapter. So lesson or learning outcome 3.1, suffixes are the last of the 4 word parts that make up medical term. They are used to add further clarification and or description to the foundation, body structure, or function. Learning outcome 3.2, Word building requires knowledge of suffixes and their corresponding meanings related to sensation and feelings. Then 3.3. Common word roots are associated with each body system. This is an overview of basic suffixes related to conditions or symptoms. 3.4. Function of the body includes body processes. This is an overview of suffixes for the student, you, to start becoming more familiar with the basic body processes. Then we have 3.5. Knowledge and understanding of suffixes related to body parts or chemical elements is important to create complete medical terms that correctly describe each body part or chemical element. 3.6. Surgical and procedural processes are common treatment options utilized in medicine. This is an overview of the suffixes that define these components when combined with other word parts. 3.7. Pathology and diagnosis are two important pieces in medicine. This is an overview of basic suffixes related to describing the disease processes and diagnosis of conditions. And finally, we have 3.8. Some suffixes have no other place in the structure and function of the body or its systems. This is an overview of miscellaneous medical suffixes. All right, everyone, that's all I have for you today. Thank you so much for joining me. I look forward to seeing you for the next chapter. Remember, if you have any questions whatsoever, please reach out. Don't sit there and struggle in silence. You can text, email, call, however works best for you. Just make sure you're asking those questions. That's what we're here for. See you next time. Bye.